In 1994, a man named Jacob Kevorkian, known to the media as Dr. Death, was put on trial killing roughly 130 people, but this was not an ordinary case because he did not murder anyone. Dr. Kevorkian was one of the first doctors to practice physician-assisted suicide. This is when a patient has a terminal illness that there is no chance of recovering from and living. Their life would only be prolonged by medicine, so they decide to take control over what is happening, and they ask to be administered a lethal dose of medication to end their suffering. In America, this is called the Right to Die Act. At Dr. Kevorkian's trial, he famously stated, "Dying is not a crime. I am for the Right to Die Act in the United States. I believe that a person is entitled to make this decision with their own life."
It's a medical service. Anybody else does that to the body, and it's a crime, a felony. But not for the medical doctor. Why is this different? He calls it a murder, a crime, a killing. I call it a medical service. Tom Yout didn't come to me because I want to die, kill me. He came to me to say, please help me.
Physician-assisted suicide is currently legal in 3 states: Oregon, Washington, and Vermont. The Oregon Death with Dignity Act states the patient must be of sound mind when they request a prescription for a lethal dose of medicine. 2 doctors must confirm a diagnosis of terminal illness with no more than 6 months to live. 2 witnesses, 1 non-doctor unrelated to the patient, must confirm the patient's request, and the patient must make a second request after 15 days. To me, this system sounds like it has a good fail-safe, and that if the person really decides to do this, they understand what is happening and they are making a conscious decision to end their life. I understand why there are some who are against assisted suicide, and it is because there are so many different factors to take into account for a person to make a decision like this. But I say, why prolong suffering? The next clip is of a professor of clinical psychology named Andrew Solomon, who spoke at the Intelligence Squared debates and was for the legalization of assisted suicide. His mother was terminally ill and participated in physician-assisted suicide.
When my mother's friend Sandy was dying of cancer, my mother visited and saw her in the hospital where she was screaming in pain and so heavily medicated that she was unable to recognize the other people in the room. My mother went to see a gastroenterologist 2 years after she got sick, who told her that she had significant tumors in her intestines and would soon be unable to digest food. She called my brother and me, and she said that it was time. It was all very much as we had planned it. She said, "The only thing I still fear is this not going smoothly." And she took the antiemetics. A few nights earlier, my mother and my brother had pulled a wishbone, and my mother had won. And now my brother said to her, "What did you wish for?" And she said, "I wished for this to be over as quickly as possible."
Every person has the right to say when it is their time to go. If someone is going to die in the span of 6 months, they should be able to either 1. Live out the last 6 months of their life and let nature take its course, or 2. Make the decision at the present time that they would rather just end their life. I agree with the legalization of assisted suicide because I think of it as myself being one of the patients. The only way to think about the situation in a professional way is to think of it as if you were in their shoes. If I only had a few months to live, I wouldn't want to be in a hospital surrounded by nurses and machines when I could be in the comforts of my home with my family. I would want to be able to see my family before I go, knowing that this would be the last time I see them. Instead of having to go day after day worrying about the chance that I won't wake up the next morning. It also would be better for loved ones as well, because they don't have to wake up to a devastating phone call saying that a relative or even a friend passed away. From personal experience of having had a family member going through a tough time with illness, the legalization of assisted suicide has become a great thing in my eyes.